Senator Bernie Sanders. I think of him as America's senator. The good people of Vermont know him as theirs. Live over at the Senate studio.
Yep.
Senator Sanders, hey.
Good to be with you, Tom.
Thank you for joining us. And we will be taking calls for Bernie right after the first break. Senator Sanders, what's wild news coming out of the Senate?
There is a lot that is going on. As you mentioned, the budget issue is front and center. The House voted to support it. It'll be coming to the Senate, I believe, next week. And I haven't yet, to be honest with you, decided how I'm going to vote on this thing. Clearly, I think no one denies that this budget is an extremely modest effort. It does not in any way, shape, or form address the major crises facing our country. There is no money going in there for job creation or rebuilding our infrastructure or moving aggressively toward energy efficiency. We have not in this budget asked the wealthiest people, largest corporations in this country to start paying their fair share of taxes. At a time when we spend on defense almost as much as the rest of the world combined, we have not made the kind of cuts in defense spending that I think would be appropriate. On the other hand, and let me be very clear about this, what I am very proud of is that I and many other people have been working for a number of years against very, very powerful special interests who have wanted to cut Social Security. They wanted to cut Medicare. They wanted to cut Medicaid. There are no cuts in this budget in Social Security, Medicare, Medicaid, and that is not insignificant. We have continued to fight off these attempts, and that's a good thing. One of the areas that is perhaps most disappointing is that we continue to have in this country not only very high unemployment. Unemployment, as I point out every week, is not really 7%. It's much higher than that if you include those people who have given up looking for work and those people who are working part-time. It's over 13%. Youth unemployment, close to 20%. Long-term unemployment in this country is a very, very serious problem. It's at a record-breaking level. And this budget does not include a provision to extend long-term unemployment. And that means that at the end of this year, about 1.3 million people will lose their long-term unemployment and benefits. And that is not only very bad for families who are suffering with long-term unemployment, but it's bad for the economy because that is money that these folks will not be spending. It will result in the loss of about 200,000 jobs. So it's a mean-spirited and bad idea not to extend these benefits. Now, the problem that Patty Murray has had, and Patty is the chair of the Senate Budget Committee, is she's negotiating with folks who want to, as I mentioned earlier, cut Social Security, cut Medicare, cut Medicaid, cut education, cut nutrition programs, give more tax breaks to billionaires, and maintain loopholes for large multinational corporations who in some cases pay nothing in federal income taxes. So she was in a very, very difficult position. But I've got to, over the weekend be thinking about what the best vote is on that. So that's one issue that is out there. I'm chairman of the Veterans Committee. One of the issues that the committee has been dealing with, and veterans throughout this country have been dealing with, is the fact that we have done VA has a very large backlog in terms of benefits claims. I'm happy to say that in recent months they have made some significant progress in closing that backlog. They're in the process of converting their system from paper to digital, and they are now doing a much better job than they previously did. They still have a long way to go, but they are making some good progress. This week, I also, in the midst of all of the discussion about the Affordable Care Act, I reintroduced a single-payer legislation, which would provide health care to every man, woman, and child in this country as a right through state-administered single-payer program. And if we do that, you will save per capita substantial sums of money. As I hope everybody knows, our very dysfunctional and complicated and wasteful healthcare system now spends almost twice as much per person on health care as do the people of any other country. It has been calculated that if, as a nation, we spent the same amount per person as do people in other countries, Tom, we would be saving over somewhere around $900 billion every single year. Can you imagine
so
that?
That's essentially the subsidy that we're giving to these for-profit corporations.
Exactly, exactly. So what you have is a system based on profit. The insurance companies make a whole lot of money. And not only do they make a whole lot of money, they distort healthcare priorities. We have a crying need, a desperate need for more primary healthcare all over this country. And if you did that, you had the doctors, you had the nurses, you had the clinics, you would actually save money by keeping people out of emergency rooms where Medicaid pays 10 times more per visit than they would if somebody went to a community health center, for example. We do nowhere near as good a job in disease prevention as we should. We have too many specialists in areas that we don't need them, et cetera, et cetera. So we have and among many other concerns in terms of our healthcare system, we have the drug companies in this country charge our people by far the highest prices in the world for prescription drugs. They resist strenuously the efforts to go from brand name to generic, where the prices can be substantially lower for the consumer. So once you have a system geared toward profit, it should not be surprising that we spend so much more per capita, that our healthcare outcomes in terms of life expectancy, infant mortality, and many other problems are worse than in many other countries. Interestingly enough, when many of my colleagues get on the floor of the Senate and they say, we have the best healthcare system in the world, well, you know what? There's a poll that came out that was done recently by the Commonwealth Fund. And they polled the people in 11 countries getting their views on how they felt about their healthcare system, just without going into all of the responses. In the United Kingdom, 63%, that's a socialized healthcare system by and large, 63% of the people in the UK thought that their system worked well and needed only minor changes. In the United States, we are at the bottom of 11 countries polled. We were at 25% thought our system worked well, only minor changes. In terms of having the need to completely rebuild the system, that it was so bad it had to be completely rebuilt. In the UK, 4%. In this country, 27%. Other countries that do have much more popular healthcare systems, Switzerland, Netherlands, Austria, New Zealand, Norway, Sweden, Germany, Canada, and France. So we are at the bottom of the list in terms of how people feel about their healthcare system, and yet we spend, for that privilege of being at the bottom of the list, almost twice as much per capita. And that's why I've introduced a single-payer system, single-payer piece of legislation. And the point there is very simple. Number one, in my view, healthcare is a right of all people. And number two, if you're going to guarantee healthcare to all of our people as a right, you need a cost-effective system, and a single-payer approach is the way to go. So essentially, it would be improving and expanding Medicare, improving and expanding the CHIP program, Children's Health Insurance Program, both of which are popular programs that work pretty well and fairly cost-effectively.
It's brilliant. It's brilliant. Senator Bernie Sanders with us. He will be answering your questions right after this quick break on Brunch with Bernie here on the Thom Hartmann Program.